on the door. Hi, Mr. Jones. I'm Bailey. I'm going to be your nurse today. And I'm going to go ahead and check you out, do a little head-to-toe assessment on you just to make sure if you notice anything abnormal or see what's going on with you. Alright, so I'm going to do my QSIN. I'm going to check the wrist name, band name. Can you tell me your name and date of birth? Okay, check your wristband. Good. Correct staff names on the whiteboard. The patient first coming in is not on oxygen, but eventually the patient does end up getting on 4 liters of oxygen. So I would check what kind the oxygen is, a nasal cannula or mask, the narrative breakdown, and the flow rate and ordered flow rate. I don't have any NG tubes, no abdominal tubes or drains, no chest tubes, no, you don't have a trach, no Foley catheter, IV and saline lock. It looks like you don't have one in yet, but you're going to be given furosemide and digoxin later. And then side rails, we've got 2 side rails, bed is in low position, got your call light, obstacles and clutter are all out of the way, assistive devices are by the bedside, water and pitcher cup, urinal, bedside commode is empty, and trash bag is at the bedside. Alrighty. So now I'm just going to go ahead and do a quick assessment on you. Before I do the assessment, some of the signs I would see for right-sided heart failure, since that is what I think is going on with the patient, is they would be positive for JVD, enlarged spleen and liver, anorexia or nausea, a distended abdomen, dependent edema in the legs and sacrum, swollen hands and fingers, nocturia, weight gain, which is the most reliable, hypertension from excess fluids or hypotension from heart failure. So I'm going to go ahead and look at your face, look at the symmetry. Okay. I'm going to listen for or feel your pulses bilaterally. Alright. So your pulse. Okay, I'm looking at your respirations. Okay, and I'm going to listen for your blood, look at your blood pressure and your temperature. Alright, so I want to note your skin was a little bit diaphoretic, a little cold, pulses, I did feel the pulses, was a little weak. And your vital signs, your heart rate was 102 to 123 and irregular. Your respirations were 24 to 32, blood pressure 150 over 72, temperature was 37.3. Okay, and then I'm going to check your neck to see if you have JVD. Looks like you do have a little bit of JVD, positive for that. Said you have cold, clammy skin. And I noticed for your weight gain, you stated that you have gained 3 extra kilograms within 3 days. Okay. We did your name and date of birth. You said you were feeling a little tired the past 4 days. Okay. Are you having any numbness or tingling in your upper extremities? Alright. I'm going to check your cap refill too. Alrighty. And any problems with your abdomen, any pain I should know about? A little discomfort in the abdomen? Okay, I'm going to go ahead and palpate each of those sites. Okay, and then I'm going to just listen to your abdominal sounds. Right, everything sounds good. And then I'm just going to go ahead and I'm going to take your lung sounds as well. Alright. And have you had any problems going to the bathroom at all? Okay. Any tubes or anything I should know about? Any burning or pain when you go to the bathroom? Oh, and are you having gas? Are you having any? Do you know when your last bowel movement was? Alrighty. Okay, I'm going to check your legs out, look if I see any edema or anything. Looks like you get a little bit. You got some edema. Okay, and then can you push against my feet? Pull away, wiggle your toes. Okay, I'm going to feel your look at your cap refill, and I'm going to feel for your pedal pulses. And then I would wash my hands again, and I would come back up to the front because I did forget to do push-pull. So push-pull for me. Okay, and wiggle your fingers. Good. I also forgot to note to wash my hands in the beginning before I started my assessment and everything. So my patient's vital signs or his respirations. He was a little bit short of breath, had respiratory, was labored. Gasping for air. I heard some crackles and wheezes, bilateral crackles and expiratory wheezes. Also noted that while he's in the hospital, he only had a urine output of 20 milliliters an hour, and it was yellow and cloudy. And then later on, the vital signs became his pulse ox was at 88% at room air. His blood pressure was 190/100, and his heart rate was 130, and irregular, and his respirations were 43. All right. So now I'm just going to go ahead and read my case study, questions and answers. So, Mr. Jones, he's 69. He came to the emergency room after meeting with the physician. He complained of fatigue for the past 4 days, shortness of breath, and abdominal discomfort. He had medical history of hypertension and coronary artery disease and had previous 90% LAD blockage and 50% RCA blockage with a stent in both of them. What initial nursing assessments need to be performed on Mr. Jones? Need to get his vital signs, look at his heart rate, rhythm, the character, his pulses, cap refill, the color and temperature of his extremities, lung sounds, assess for any angina, assess for edema, assess his physical limitations. The diagnostic test that I would anticipate being ordered by the provider is an ANP or BMP, and that will be looked increased. His electrolytes, I'll check the potassium, bun and creatinine will look increased. A hemoglobin hematocrit will be decreased. ABG will be decreased. PO2, T4 or TSH, liver function test, UA, chest x-ray, ECG, echocardiogram, pulmonary artery catheters. Okay, so then it was also noted that Mr. Jones had gained 3 kilograms within the past 3 days. The significance of his weight gain, this is that it shows that he's retaining fluid, and it also means that his blood vessels are getting backed up by blood because the right side of his heart isn't pumping. The medications that I would anticipate for the doctor to be ordering would be diuretics such as loop diuretics, thiazide diuretics, potassium sparing diuretics, digoxin, potassium, ACE inhibitors, NATCOR, beta blockers. They'll help decrease his blood pressure and afterload and help with heart contractility. Nitrates, they help with afterload. Morphine helps with pain and anxiety. Phosphodiesterase inhibitors, antiarrhythmics, digibind, All these drugs will help with reducing preload and afterload and improve with cardiac contractility. Okay. So then 3 hours later, Mr. Jones became cool, clammy, his respirations were labored, and he complained of abdominal pain. He was diaphoretic and gasping for air. He had JVD, bilateral crackles, expiratory wheezes. Pulse ox was 88 at room air. Urine was 20 milliliters an hour. Blood pressure at 190 over 100. A heart rate of 130 and irregular respirations at 43. The nursing interventions that I would perform right away for Mr. Jones is I would administer his medications right away, such as diuretics or beta blockers. I put him on oxygen, position him in high Fowlers, and notify the doctor. So what's happening to Mr. Jones physiologically is that his heart isn't pumping a sufficient amount of blood to meet the body's requirements. The patient is having symptoms of right-sided heart failure, and this occurs when the right-sided chamber is no longer pumping and the heart can't fill with blood, and then it backs up into the veins. From this condition, the patient is then experiencing fluid excess because of the increased JVD, the crackles and wheezes, increased blood pressure, abdominal pain. So medications to be given to decrease Mr. Jones' preload would be nitrates. For his contractility, it would be digoxin, dobutamine, milrinone, and medications to decrease his afterload would be ACE inhibitors or nitropres. So then later, Mr. Jones, he received furosemide at 80 milligrams and digoxin at 0.5 milligrams at IV. And the expected outcomes for furosemide is that it decreases edema, decreased abdominal girth, increased urinary output, and decreased blood pressure. The expected outcome for digoxin is a decrease in the severity of the HF, increase in the cardiac output, and termination of atrial fibrillation. So that's all for the case study. All right, so now I'm going to report off to my nurse. I would state, this is Mr. Jones. He's a 69-year-old male. He came to the emergency department complaining that he had fatigue for the past 4 days, shortness of breath, and abdominal discomfort. His medical history says he has hypertension, CAD. He has a stent in both his LAD and RCA. They did a further assessment. He had crackles bilaterally and tachycardia. His chest x-ray showed he had cardiomegaly and bilateral pulmonary edema. ECG revealed that he had atrial fibrillation. His vital signs were his blood pressure was 150 over 72, heart rate 102 to 123, respirations are 24 to 32, temperature was 37.3. His urine was yellow and cloudy. So his BUN was 17, creatinine was 1.2, hemoglobin hematocrit were 11.8 at 36.2%, LDH was 705, and his BMP was 843, and his height's 175 and weighs 79 kilograms, but he said that he had gained 3 kilograms more within 3 days, and then he was admitted to the cardiac telemetry unit. So then about 3 hours went by, and his skin became cool and clammy, respirations were labored, complained of abdominal pain, he was diaphoretic, gasping for air, JVD, bilateral crackles, expiratory wheezes, pulse ox was at 88% on room air, urine output was 20 milliliters an hour, blood pressure 190 over 100, heart rate 130, and respirations were at 43. So then they transferred him to the CCU for hemodynamic monitoring and aggressive therapy, His CVP was at 19, cardiac output was at 4.5, cardiac index was at 2.3 liters a minute, and then his pulse ox was then at 96% on 4 liters of air through a nasal cannula. And Mr. Jones, he received furosemide at 80 milligrams IV and digoxin at 0.5 milligrams IV.